Evaluation of peripherin biofluids of patients affected with motor neuron diseases. Neurofilaments are recognized as promising biomarkers of neuronal injury and disease activity. Peripherin is a type 3 intermediate filament protein which assembles with neurofilaments, mostly neurons of the peripheral nervous system. In the study, we evaluated peripherin concentrations in cerebrospinal fluid and serum of patients with motor neuron diseases and tested whether they may be related to motor neuron degeneration. This is a retrospective longitudinal study on a cohort of 160 patients. 91 patients with different motor neuron diseases were compared to 26 patients with dementia, 14 with peripheral neuropathy, and 29 healthy subjects. We measured peripherin concentration in cerebrospinal fluid and in serum, and light chain neurofilament concentrations in cerebrospinal fluid. Of ALS cases, we further recorded disease extension, progression rate, and overall survival. These are the demographic and clinical characteristics of our population. All cerebrospinal fluid samples had peripherin measurements below the detection limit of the assay. Serum peripherin levels were significantly higher in all motor neuron disease patients. We confirmed light chain neurofilaments to be significantly higher in ALS group compared to healthy controls and polyneuropathies, with no significant difference between ALS and dementia groups. In ALS group, peripherin levels and overall survival did not correlate. Conversely, a significant inverse correlation between logarithm of light chain neurofilament concentrations levels and overall survival was found, adjusting for the concurrent effect of sex, progression rate, and age at onset. In the study, we demonstrated that peripherin is more concentrated in serum consistently with the predominant localization in the peripheral structures. Serum peripherin was found to be increased in all motor neuron disease patients compared to controls, highlighting the chance that serum peripherin elevation may detect the lower motor neuron involvement occurring in these patients. Serum peripherin is more sensitive than light chain neurofilaments to unmask lower motor neuron injury. We failed to observe any correlation of peripherin with light chain neurofilaments concentrations as well as with disease severity or survival. In fact, peripherin is not only released by the imaging reads, but also upregulated due to the neuronal injury. In conclusion, we can affirm that high serum levels of peripherin may be a general marker of lower motor neuron axon disorders. Serum peripherin levels may not exactly reflect the number of damaged neurons and thus the degree of motor disability. Thanks for watching.